Hi, I'm Dr. Faisel Syed. Welcome to another episode of Faisel and Friends. We're here because we believe everyone deserves access to quality primary care, and ChenMed needs physicians to take care of them. Tonight's topic is the role of specialists in value-based care. My co-host and moderator of the chat is Dr. Dan McCarter. Welcome, Dr. Dan. How are you doing?
Hey, Faisal, it's great to be with you this evening.
It is great to have tonight's topic. I'm really excited to have this conversation about the role of specialists in value-based care. And joining us tonight is our very own Dr. Scott Tromanhauser. Thank you so much, Scott, for joining us tonight.
Happy to be here, Faisal and Dan. Thank you for inviting me.
You know, one of my favorite, when I was in residency, I mean, there's a lot of fun times in residency. I did my training at an unopposed family medicine program, and I loved the morning coming into the doctor's lounge, and there were always those attendings that we could curbside, and I miss that. I miss that in my regular day-to-day life now. So to have you come on tonight to talk about the role of specialists in value-based care is particularly fun.
Great.
So I wanted to know, how did you, I'd like to know about how did you make your way to ChenMed as an orthopedic surgeon coming to a primary care geriatric practice?
Yeah, it's funny. So many people ask me that, and occasionally I ask myself that. But I'll tell you, it was a long journey. It started 15 or more years ago. I spent my career, some 27 years, at a world-class orthopedic surgical hospital, really doing great work, dedicated private practitioners, delivering the best care, demanding the most of themselves and everyone around them. Because of that, we attracted the attention of Michael Porter and Elizabeth Teisberg. And Michael Porter is at the Harvard Business School. Elizabeth was at Darden in Virginia at the time, and they were writing a book that has become the sort of I'll call it the Bible of value-based care. It was published in 2006, called Redefining Healthcare. And I had many conversations with Elizabeth and ultimately Michael, and I've been involved off and on with Michael Porter's effort at Harvard Business School to get the message out about value-based care. And I went on to do a master's program in healthcare delivery science at Dartmouth. Elizabeth Teisberg was sort of the keynote person who had been recruited up there. So my journey just continued. I finished that program 5 years ago. And then you get to the point where you have the burden of knowing. So that comes from a term my wife came up with. She went to Africa 15 years ago to do some work in Zambia. And when she saw what she saw there, she's an OBGYN, she said, it's hard to turn away and want to do anything else. She said she had the burden of knowing. So I had the burden of knowing the problems within the fee-for-service system. And they become more and more obvious the more you learn. And so this opportunity came a knocking, and I looked at this. It took me 3 seconds to understand what ChenMed's challenge was as a primary care organization. And I said, I got to get this job. I love this. And here I am, and I could not be happier with the choice I made.
Wow. You know, in my community health days, one of the biggest complaints I had from the specialists that partnered with the community health center was that the primary care doctors aren't doing the proper workup. I'm spending all this time as a specialist doing primary care work, and it would go on and on. All different. It didn't matter what the specialty was. You pick it, urology, orthopedic surgery, whatever it was, and even to the emergency room doctors. They would say, hey, most of what I'm doing over here could be managed by a primary care doctor on the outside. And when we connect with doctors outside, they're like, yeah, but we just don't have the time.
That's true. And I put together a team of 11 specialists, all the major specialists you might guess: cardiology, orthopedics, neurology, nephrology, and on, the big ones. They all came with the same point of view you just expressed, that so many of the consults that they saw in their office were unnecessary, no workup, and they wound up doing the simplest things for these patients that primary care certainly could do. And that's part of the role they're playing at ChenMed, which I'll let you take us there, Faisal, when the time comes. But we've all recognized that much of what we do as specialists is really simple stuff. I'm trained as an orthopedic spine surgeon. I had the luxury of being able to screen patients to see me in the office, but I had some colleagues who had PAs who would let anybody in the office who that one day of back pain, and most of back pain can be cared for conservatively, didn't need surgery. Going to see an orthopedic spine surgeon for conventional low back pain is equivalent of seeing a cardiothoracic surgeon for your first episode of chest pain. We just don't do it that way. And, a primary care doc is capable of taking care of that first episode of chest pain. Maybe you might want to get a cardiologist involved at some point. And primary care is perfectly capable of taking care of simple problems like knee pain, shoulder pain, back pain.
Do you think that there's a way in the fee for service world for some more efficiency? Because we know what the life is like. 95% of the system is still based in fee for service. But is there a way to have some efficiency in the fee for service model when the primary care doctors have all the burdens with the paperwork and all the bureaucratic, everything that's involved with their day-to-day lives? They're not even averaging two visits per patient per year.
So I think there is, and I think it's about relationships. You have to develop relationships between, primary care docs and specialists, and in some communities that exists, obviously smaller communities,
Sure.
everybody kind of knows each other. It probably works better. Curbside consult is easier to get, or your neighbor is, the urologist or the neurosurgeon, whatever it is, it's easier. But in a big metropolitan area, that doesn't work so well. I think it's a challenge. It's a real challenge. I'm not sure it's achievable the way we achieve it at ChenMed. So I don't have a good answer for you.
Well, in value-based care in general. So in the value-based care world, I mean, you could try to simplify value-based care. There's three general types of value-based care models. There's the shared savings. There's some downside risks, these hybrid models. And then you got the fully capitated world, the world that we're in right now. But now in value-based care in general, what do you see the role of specialists in the value-based care world at large?
So I say this to my team all the time. If everyone practiced evidence-based care, we'd have no ChenMed. There would be no need for it. We wouldn't need all these elaborate risk-bearing arrangements. It's about getting people to do the simplest things in their office. It's about getting specialists not to add on testing, procedures, understanding what's a low-value procedure, getting away from this system of RVU tallying. It's really a ball and chain. On the other hand, primary care docs really need to learn what we're seeing at ChenMed. They just learned the major problem in each of my 10 specialties. It would be enormous.